House Father for 6 minutes, Anthony, please.
Thank you, Madam Chair. And I want to start by saying I think it's pretty ironic that the last time that Méta was here, Mr. Chan was unable to tell me how much ad revenue Facebook derived in Canada, but somehow today was able to extrapolate how much value Facebook offered publishers for links that publishers, had Facebook send them to. So basically, I'm going to ask a number of questions. If I ask a yes or no question, I expect a yes or no answer, please. Last week, Facebook said they were disappointed that they weren't invited to come to committee. Mr. Dinsdale, did Facebook ever contact the chair of this committee or the clerk of this committee asking to appear?
I'm not aware of the intricacies of that. That would not be an answer.
Yesterday I checked with the clerk. The answer was no. The last time Facebook was here, Mr. Chan and Mr. Dinsdale, I asked a number of questions about the experience of Facebook in Australia when you threatened to take down pages because of the similar legislation to C18, and then Facebook did so, causing chaos for a week. You said at the time that you could not answer. You did not know what happened in Australia. As a result, this committee summoned Mark Zuckerberg, your CEO, who could have answered the questions, and he ignored the committee's summons. Given that last week Mr. Dinsdale made the same threat to Canada about shutting down pages, and Mr. Chan did the same in his testimony today, I certainly hope you're both able now to speak to the Australian experience. So various whistleblowers have stated that in order to plan for the Australian shutdown, they required multiple staff members to preemptively sign special NDAs. Mr. Dinsdale, do you normally require staff members at Facebook to plan to sign NDAs for major Facebook events?
Again, sir, that is not a part of the business that I am that familiar with. I would not be able to speak to that specific question.
Were you or Mr. Chan asked to sign an NDA to plan for an eventual takedown in Canada?
I would say, sir, that we are here to try to engage in the substance of the bill in the spirit of cooperation, and to express simply that if the legislation passes as it is proposed, we may be forced to consider whether or not we would take that action.
But I asked you a specific question.
Oh,
did you,
Mr. Housefather.
Mr. Chan, the question is to Mr. Dinsdale. Mr. Dinsdale, the question was to Mr. Dinsdale. Mr. Dinsdale, did you or anyone that you know of, were you asked to sign a specific NDA to plan for a shutdown in Canada?
So again, we're here to engage on the substance of the bill in the spirit of cooperation. And what I can share is that if the bill passes as it is proposed, we may be forced to consider whether or not we would take any kind of action.
Okay, well, I guess I'm going to take that as you're refusing to answer whether you did or did not, and I would probably take that as an affirmative.
Mr. Housefather, would you like to ask me?
Mr. Chan, please.
Whistleblower documents.
When a question is addressed to you, you can speak, and I'm afraid you cannot intervene right now.
Whistleblower documents from Australia said that although Facebook said implementing the ban was intended to affect only news outlets, executives knew its process for classifying news for the removal of pages was so broad, it would likely hit government pages and other health and social services. It did in fact hit over 170,000 pages, including the Department of Fire and Emergency Services, the Council on Homeless Persons, Suicide Prevention Australia, Domestic Violence Support pages, the Kids Cancer Project, the Royal Children's Hospital, the Jewish Holocaust Center, State Fire and Rescue during fire season, and municipal, state, territorial governmental pages. Facebook then said that this was a technical error that Facebook worked to correct, and that any suggestion that Facebook did this deliberately was categorically and obviously false. Mr. Dinsdale, do you agree that it was a technical error and that there was no attempt to shut down these pages?
My understanding of the situation is, as we've expressed it, that any of those takedowns would have been done in error and were rectified as quickly as possible.
Funny enough, they seem to have been rectified as soon as the Senate approved the revised bill with Facebook amendments. The Facebook response team was able to then do it within a matter of minutes when the Senate adopted the amendments, which was 8 days after the initial takedown. Can you explain, Mr. Dinsdale, why there was such a discrepancy, how these pages somehow couldn't get restored in a timely way, but then suddenly, when the Senate approved the new revised bill that Facebook had renegotiated, then the pages were magically restored?
I mean, that to me sounds somewhat, in all due respect, speculative. And so what I'm able to share is what we have shared that any errors that were made were rectified as quickly as possible, sir.
Okay, that's fine. But what we've understood again from whistleblowers is that Facebook did not use a standard canary process to text this algorithm precision and identify, prevent, overblocking before an action. And despite clear notice that the lockdown was affecting far more sites than publicly acknowledged, which would normally have triggered a pause or a rollback, senior executives ordered the full rollout to take effect within hours. So how then do we trust the fact that this was a technical error? And can I ask, did you do a postmortem in Australia? And can you assure us that the same situation won't reproduce itself in Canada?
30 seconds for an answer, Mr. Dinsdale.
Thank you, Dr. Fry. Sir, I think that what I can share is that, again, if the bill passes as it is proposed and we are forced to consider this option, that we would try to do it in as much consultation and transparency as is possible. What that means, I certainly am not in a position to elaborate, but I can certainly reiterate that any mistakes that were done in Australia were exactly that, mistakes.
Thank you very much.